closer look at the current trends right here in the tri-state. You see COVID-19 cases going up. This is Ohio. Look at the 14-day trend. It was at 1,263 over a 14-day period average. But today alone, 1,666 cases reported. But wait till you see what's going on in Kentucky as far as these numbers are concerned. Over 14 days, 1,478. Look at this jump. This is brand new today, 2,576. Of course, we want to check out Indiana as well. And in the Hoosier State, right there's the Hoosier State. It started out 1,206 over the last 14 days as an average. Today, 2,009 alone.
It's a question, do you want to be right or do you want to be healthy?
New at 11, having vaccine conversations, and those can be critical for so many. Millions of Americans say they won't get the shot despite pleas from loved ones. WCPO 9 News reporter Jake Ryle spoke with a local psychologist who says friendship can be more important than actual facts.
We've heard it for months. For many on the COVID-19 vaccine, worry and hesitancy.
Mistrust means that, the people who you get your information from for anything, who you trust the most, are people that are closest to you.
There's a lot of people that's scared to do it, so it's like person to person thoughts on that. I can't explain.
State and local health leaders continue urging folks to get the shot to help reduce the spread.
To try to debunk any of these myths regarding danger related to vaccines, so that we don't continue to drive vaccine hesitancy.
But sometimes that simply does not work. A local psychologist I spoke with says if you're planning on trying to convince someone to get the shot, don't start with facts, but start by building trust. Dr. Stuart Bassman says many chose not to get the shot out of fear or false evidence appearing real.
People are being so not blinded, but they're closing their eyes to the evidence. And what's making them close their eyes are the fear, are the anxiety.
He says many turn to social media to seek out information to confirm their beliefs. It's something called confirmation bias. So how do you have a conversation with someone on such a polarizing subject? Dr. Bassman says it starts with compassion and consideration.
You say to a family member, I know this is scary and frightening for you, and I know you're afraid.
He says it's important to be understanding and patient. That means setting aside facts and scientific evidence to simply come together, meeting in the middle.
Instead of trying to get the person to change, because you can't do that, but what you can do is imagine that you're with them in their fear.
The vaccine developed at warp speed. He knows relationships take time.
We really need to come together and really do something to end this.
Jake Ryle, WCPO 9 News.